Hi, do you mind starting by introducing yourself, please?
Hi, I'm Rajat Khosla. I work as Human Rights Advisor for the World Health Organization at the headquarters in Geneva.
And thank you very much for doing this conversation with us. I think the first question I really want to ask you is, can you talk about how COVID has affected you personally?
Thank you. Thank you, Sophia. And it's a pleasure to join you for the conversation. I guess in terms of how COVID has affected us as a family, I think just beyond just lockdown and homeschooling and home working, which I think has affected millions of people around the world, my family and I were faced with a bereavement whereby my partner's father died of COVID in a care home for dementia patients in UK, which was very sad in multiple ways, but most profoundly for us, not being able to be there with family during such time was very, very hard.
Thank you for telling us about that, and I'm really sorry. How has COVID impacted your work? Do you have a sense of kind of what it means in terms of the organization that you work with, but also the communities that you work with? And do you think there's anything about how COVID is impacting the kind of things that you do that we need to be thinking about, not just now, but in terms of work going forward?
Of course, COVID, and in my case, COVID and human rights related dimensions did supersede everything that I was doing over the last several months now. However, I have to say, for us, and we are very privileged that way, being where I am, much of the work did continue, although from home. However, some serious reprioritization had to take place. Things related to field research and work directly in terms of capacity building with the partners and communities could not happen. And that came to a grinding halt almost instantly. And I think that is one part of it which does worries me a little in terms of our ability to restart some of those research projects which were meant to be more field-based. In terms of what implications it has to how we work and what we do and for the future, I think one of the biggest telling point for me is that business as usual will not work. And I think at a level must not work. I think we need to identify new ways of working, new ways to connecting with communities which are very vulnerable and increasingly more marginalized than they were before they went into COVID. How do we bring in that sense of community engagement into our work is extremely important. But this is where I think we need to identify new techniques, ideas, methodologies. Technology is one, but I think more also building their capacity to use these platforms and to engage with the global processes is ever so profound now.
And do you have ideas for how that could happen?
I think we need to invest more in terms of ground up momentum, in terms of access and use to technologies. It's highly inequitable, even with with the cell phone penetration rates and internet reach that is all around the world now. The question becomes is how far we are having equitable access to the kind of methodologies and approaches that we are talking about. I think we need to rethink our research paradigms in global health much more differently. I think we need to build in community engagement and voice from an early point in the discussion rather than in terms of data collection is where many people think about that. I think we need to think about issues in terms of global cooperation on how these things need to be connected with each other, and can we use more country level, regional level mechanisms and approaches to ensure ongoing engagement.
I hear you. And do you think that these are things you knew before, but it's something that COVID brought to light, or are these new and different things?
I think for people like me who engage on issues related to global health, sexual and reproductive health in particular, which is what I work on, from a human rights and gender equality perspective, these issues have been pretty much at the core of what we do. But I have to say that even within that space, these were the add-ons that one aspired to do, but were not always essential. I think one thing which this pandemic has taught us is that this has to be part of the core business on how we do some of these things. Human rights, issues around gender, community engagement cannot be afterthoughts or the optional add-on into our repertoire of work.
My last question is kind of more of a philosophical question, which is really this thinking in terms of some of the most important things that you think that we as a society should take out of this experience? And, you know, what are some of the key lessons in terms of from your thoughts more broadly, like just kind of where do we go with this and what can we learn from this more generally?
The world will never be the same again. I think the world has changed dramatically. I don't think the world as we knew in January exists anymore. I think it's changed. I think one of my most fundamental lessons has been we are in this together. There is no other way. And the success of our battle with COVID will lie with how we address the needs and the vulnerabilities of the most marginalized. We cannot go back to the same levels of consumerism, of climate damage, and models of living which are very unsustainable.
And I guess just the final wrap-up question to that, and is your sense that there's an appetite and there's a recognition of the kinds of things that you're saying, and that there's an ability, if people want to mobilize, if people want to act towards this, that there is some sort of stronger sense of the issues that you're raising?
I certainly hope so. I certainly hope so. And I hear that. I hear that in my institution. I hear that on a regular basis in the remarks from the Director General. But I also hear that in the work of activists and people on the ground who are increasingly voicing these sentiments. And whether it is the climate activists who are working in different regions in the world, or whether it is those who are trying to reach out to migrant workers in another part of the world, or those who are trying to ensure that women have access to services that they need during pandemic. I think if you hear those voices, it's very clear people are asking for a fundamental change in how we live and how we go on from here. And I don't think those voices are going to be silenced. I think those are very strong voices demanding some serious change.
Thank you for that, and thank you for the little bit of hope there at the end. Okay.
Thank you. It's a pleasure, Sophia. Thank you.
Thank you very much.
Bye-bye.